Now, though, with that breaking news, the doctors walking off the job this morning at Elmhurst Hospital are residents who have finished their first year of postgraduate training and are on the way to becoming attending physicians. They are demanding to be paid the same as their counterparts in Manhattan. Eyewitness News reporter Michelle Charlesworth is live at Elmhurst Hospital with the breaking details. Hi, Michelle.
Good afternoon. $7,000 a part. That's what we're talking about here. And when doctors strike, definitely gets your attention and it definitely gets interesting. Right now, these resident doctors make $68,000 a year. Now, these are doctors fresh out of medical school. These are beginning doctors. $68,000 a year. They want $7,000 a year more, bringing them up to $75,000. That is not a random number. Where does that number come from? On East 98th Street at Mount Sinai, that's exactly what resident doctors make. They want exactly the same. They also demand a safe ride home. They tell stories of being harassed or hurt heading home in the wee hours after a long shift. And they want simply the same as Mount Sinai residents in the city, a safe lift home with a car service.
It's about a $7,000 raise, and like if you calculate it out, saying that we work an average of 60 hours a week, which we probably work a little bit more than that, 60 to 80, then it's like $24 an hour is what we're making now. We're asking for like 28, and they're offering us like 26.
We've had a resident earlier this academic year who was hit from his moped when he left work, and he had multiple broken bones. Those are things that could be averted if there was parity.
Okay, coming back here to Elmhurst Hospital, live shot of the strike still going on. You heard from Doctors Wahlberg and Ellis. They say, we work at a hospital. We don't want to end up here because they got jumped or hurt on the way home after working long hours. They also remind people they have studied for 8 to 9 years. That's intense study in medical school and undergrad to get to this point. Many of them come from overseas. They deal with huge student debt, hundreds of thousands of dollars, and they say, you know, that's on top of all of this. They would like to see a $7,000 per year raise. They say they're really not that far away from what the medical system, what the hospital system is talking about, so they do have hope that there will be a resolution. In the meantime, the other doctors who work here, who are not residents, are covering their shifts so that patients can receive good care. They say they worry about that as well.